Another rainy good morning to you all. I take absolute pleasure to welcome you all yet another episode of the Sunday special 60 minutes with psychiatry teachers. This is a combined effort of the IPS teachers of Psychiatry Forum, IPS UG Education Subcommittee, and IPS PG Education Subcommittee. This unique initiative is supported by Minds United Trust and in the past several months has become a well-known and recognized pan-India platform for various stakeholders involved in training and teaching of psychiatry to share their experiences and further improve the quality of medical education in this country. And this is the second of this new series wherein we get to meet and interact with the must enrich research grantees and their mentors as well. For the sake of the people who have joined newly for this episode, I would like to introduce the ITOP Must Enrich Research Grant for Psychiatry Teachers, which is another initiative of the Minds Trust for Health Sciences and Humanity Trust and ITOP, the Indian Teachers of Psychiatry. This is funded by Infosys Foundation. We were discussing last time that every year we are churning out more than 1 lakh MBBS students, and the need to produce quality doctors has never been greater. Unfortunately, there is such scarce Indian data on teaching and learning methods, and the needs and wants of our own Indian medical students are not well studied despite being very different and unique from the Western standards. This grant, through a series of studies on teaching methods, aim to add evidence to Indian data on teaching and learning methods, especially for psychiatry education in India. With this introduction, let me introduce our speakers to you. The Must Enrich Research Grant Awardee from Pune, Professor Dr. Sharmistha S. Deshpande. Madam has done her MD in psychiatry at BJMC Pune. She is a visiting consultant psychiatrist at Suryaprabha Nursing Home, Powad Road, Pune. Currently, she is working as head of Department of Psychiatry at Srimati Kashibai Navle Medical College and General Hospital, Pune. She earlier worked at MIMER Medical College at Talegam and BJ Medical College at Pune. She has more than 22 years of teaching experience with special interest in psychodermatology. Madam has published more than 19 research papers in various national and international journals and has been awarded the Best Research Paper Award at BGMC Research Society Conference in 2004 and 2010. Request participants to kindly mute their mics. Her other achievements include interest and expertise in licensed psychiatry and has presented the research work in psychodermatology in national and international conferences. Dr. Sharmistha has been actively involved in teaching communication skills and stress management to UG students, interns, and PG students of the medical college. And she has been actively guiding undergraduate students research in psychiatry and has been a visiting faculty at various institutes for stress management in students for students in psychiatry and law, in child psychiatry and mental health, etc. Most importantly, Madam is a standing example of, despite being a very senior and resourceful person to many institutes and students, she still has the learning, the curiosity to take up yet another research grant and strive to improve the medical education in our country. Once again, welcome to you, ma'am. Dr. Vikas Menon, thank you once again, sir. Can't thank you enough for being involved in improving teaching learning methods. As we all know, sir has been long associated with Institute of National Importance, JIPMER at Pondicherry. Sir is a well-known teacher and psychiatrist and continues to serve JIPMER as a professor. He is passionate about teaching and research, has been associated with National Teachers Training Center, which conducts courses biannually. Thank you, sir. With this, I hand over to you, ma'am. Let's begin the presentation, which you have successfully completed with the support of Minds Trust. Thank you, ma'am.
Thank you so much, Dr. Raviteja, and thank you, Minds United Trust, for encouraging us to undertake this research. It has been a wonderful experience, and actually, I am sharing a very little part of it, very glimpse of it due to time constraint. But I am very happy to share the main findings that I had during this research. So it was about mainly research involving interns in psychiatry. And we have tried to see that now we are going for competency-based curriculum. So what is the current state of learning in psychiatry during internship, and how can we improve upon it, and what are the expectations in the CBME curriculum, and what we can do further to enhance the current learning. So can I have the next slide? Yeah, so that is why we did this study, because medical undergraduates, they need to know what is psychiatry, and equally they need to know what it is not, because there are a lot of misconceptions, as we see among the doctors from other specialties, and often timely referral to psychiatrist is delayed, and then we say that they don't have enough knowledge of psychiatry. But what is in our hands to focus on these youngsters at early stage and give them a good experience of internship in psychiatry, very enriching and interesting experience. So I thought that will really help us to produce more effective and efficient undergraduate doctors in psychiatry. So currently, when interns are posted in psychiatry, we know that we should know that what are the experiences when they are working in the psychiatry department. What do they expect when they are working? What are they exposed to during these 2 weeks of internship? How is their interaction with the various mental health professionals, and what are their reactions to interacting with the psychiatry patients? So these are all the points we tried to cover. So in the next, we'll see that what are the common hurdles. So normally also we are with our interns, but normally, when we ask them how was their internship, they give very formal responses. There is not enough communication because they are with us only for 2 weeks, and we have not yet developed enough rapport with them. And they are often interested only in just, tick mark exercise, completing the psychiatry posting, and in their own world of PG NEET, as we know. So I've undertaken this study. So next slide, we see that also from our side, often we have time constraint, we have less number of faculty, there's so much of other work to do, and we don't give enough time for interacting with the interns. So next, that is what I did in this study, that I tried to interact with the interns in our department. Next, by the way of focus group discussion. So I interacted them in a group of 5 to 6 interns, and whatever spontaneous responses were obtained, they were written down, and then we presented it in a kind of semi-qualitative format to make a research paper out of it also, and we tried to compile the findings also. And their interaction was facilitated by giving them personal feedback, observation, and my experience was the interns enjoyed talking and discussing about their internship in psychiatry, and it was a positive experience. Actually, they had liked being in psychiatry, they had liked interacting with patients. They knew a lot more than just theory lectures when they came for internship. Of course, many of them had missed their undergraduate posting or not learned much in that posting. But internship, yes, it was definitely much better exposure to psychiatry. So now, in the next slide, now I'll share with you what all we did. That we also had given them initially some psychiatry MCQs to see what was their overall level of knowledge of psychiatry, and see how much they are confident in managing common problems in psychiatry and their overall attitude towards it. Next. So the objective of the study was to document the knowledge and views of interns towards the psychiatry internship posting with the help of focus group discussion. So we know that the National Medical Council of India expects every IMG, Indian medical graduate, that he should be able to work towards the goal of health for all. So which health for all means it also includes mental health. So the newly proposed regulations for internship in psychiatry for CBME, they have been released recently. So we refer to these, and they emphasize the exposure of the medical intern to psychiatry OPD, and mainly they should be able to deal with various emotional reactions of the patients, and they should be able to manage the behavioral disorders associated in medical and surgical patients. So mainly the focus has been increasing on liaison psychiatry, which these youngsters they are going to do. So next. So what we did is I did get ethics committee approval from our college. The batch of 125 interns, they participated in this study, but the overall analysis due to completed forms was done for 115 interns. In that, first I'll share with you the objective findings, followed by findings in the focus group discussion. So in the objective findings, mainly, most of them, 91.3% felt that internship in psychiatry, it is necessary to complete their medical training and to be a good doctor. And most of them recognize psychiatric problems as valid medical illnesses, and they need treatment, they need empathy, and they did have attitude of non-discrimination towards the psychiatric patient. So they did not have much actually negative attitude as such. Only few of them reported that 2 weeks were not enough. They are inadequate to learn psychiatry, because they come to know that psychiatry is such a vast subject actually. Next, then nearly half of them reported that they would be able to identify or diagnose mental disorders in their practice. So at the end of internship, half of them were confident that yes, they know now what is major depression, what is schizophrenia, what is bipolar disorder. But half of them said no, we cannot, we won't be able to make out when we go to practice. But however, only 24.3% reported that they would be able to manage even the common mental disorders. So if I ask them, like if there is a student with anxiety, or there is some person with mild depression or adjustment disorder, what drug you will give? Do you think, are you able to handle that? So they were not at all confident in prescribing any drug or handling this problem. 1/3 of them did feel competent in handling grief or emotional reactions in various physical illnesses. And a good number of them, they were aware that mental health problems, they can arise in any patient who is chronically ill. So next, now we'll go to the findings of focus group discussion. So first I discussed with them what is their routine in the psychiatry posting when they are posted. So they said that mainly they help PG residents to take the round of indoor patient, they record the vital functions, pulse, BP, this oxygen saturation and so on. And they also attended OPD, ward round, and they observed the psychiatric patients being interviewed and conducted. So they also sometimes explained the medications to the patient at times. So that was their work routine that they told me. The next, so what were the goals they were supposed to achieve in these 2 weeks of learning in psychiatry? So they were not very clear that what they are supposed to do in the 2 weeks that they are posted in psychiatry. So they were given logbooks and they were told that they have to complete it, but still they lacked the clarity of exactly what they should learn in these 2 weeks. There's some verbatim of them. So what they said, like we get to see psychiatric patient in this posting, we become aware about the variety of patients. So, they were very surprised to see that there are so many types of patients that come to us. And they said that we come to know about how they present and how they are handled. And we also learned communication skills, and we learned to be a good listener. So they did appreciate that the residents and teachers in psychiatry, they had much better communication skills. And the way we talk to patient, the amount of time we give for each patient. So they did appreciate that this is something different from the other departments. Another intern said that there is a huge difference in theory and practical. So we got to know actually how history is taken in psychiatry, and we have to keep our emotions aside. We have to deal with the patient's problems. So at emotional level also, there was some changes. There were some experiences that they had, and they felt good about it. Next. They did have some expectations when they come for psychiatry posting. Many of them told me that they wanted to learn how counseling is done, and also they wanted to do counseling by themselves. So actually what happens is we don't give any direct work to interns, but they did wanted to actually under supervision do some kind of psychological work with the patient. So actually we have to think how we can do this. Because they found the routine work to be monotonous, and some of them expressed that they in fact, they should have taken initiative to, study some cases in detail. Now, what I thought about this is now that they have this elective posting in third year, maybe we can give them this case histories and case studies to do. There was occasionally some negative experience also, like one of the female interns, she said that when she was taking BP of uncooperative patient, because he was manic, because of his grandiosity, she felt disrespected and she was taken aback by his attitude. And she said, no, psychiatric patients are arrogant. I will never take up psychiatry in future. You know, they don't treat doctors properly. That's what was her experience. Then about ability to manage common mental disorders, most of the interns, they were not confident in treating even insomnia or anxiety. And they were also not confident in prescribing any drug except for, again, alprazolam only. So that was, again, very surprising for me, because in our OPD, we hardly write alprazolam. They did see that what prescriptions we are giving, but that learning is not taking place. Somewhere we have to see how they learn that, how to use the common anxiolytics and how to identify and manage these patients. So about handling psychiatric emergencies, some of them knew how to manage suicidal patient, how to manage that suicidal patient should not be left alone. We should refer him to psychiatrist as soon as possible. The previous one, please. And we should try to solve his difficulty. We should be with the patient. But half of them again didn't have any idea how emergencies are handled. In case of violent patient, they knew what they had seen. Like they had seen a violent patient coming to OPD. They said that we know, then we take help of security, we give them some injectable. But then again, what injection we give, they were half of them, they were not aware that which drug is used in emergency. So they were observing, but not very active observation they had done during their posting. Many of the interns had seen actually how electroconvulsive therapy is given, and they said that that resolved all their misconceptions about ECT, and that was a good experience that they got to see how ECT is given. So these were the main points that we discussed. So in conclusion, I would say that they did get better knowledge about psychiatry rather than the previous batches, but they are yet not attaining the required competencies which may be required for handling emergencies or use of basic anxiolytic drugs in their practice. I think that involvement of senior faculty is very much needed in formulating and implementing this training of interns, and also active participation by senior faculty. And they can be given role exposure to the role of psychiatric social worker and clinical psychologists, because they should know what work the clinical psychologists do, psychiatric social workers do. So they had not met these people actually during their posting. Then their competencies in diagnosing and managing mild morbidities need to be enhanced, and there should be a definite, I think, some internship plan as to how do we cover all these points for each and every intern. So more structured internship program is thus needed so as to make the competency-based curriculum more successful in psychiatry. So that's all I had to say in short. So my experience of doing this study, it was a highly rewarding experience. Firstly, my own interns, they taught me a lot of things. So personal interaction with them really helped me in understanding them. What is their perspective? It's very important that teachers understand the perspective of the students or the interns. Then we can make the teaching better. Then for me, myself, inputs from mentor Dr. Vikas Menon sir, they were highly valuable. He's really a magnificent teacher. He knows so many new things, I got to know from him. And this must enrich grant, I would say one good thing is, they encourage you to do this time-bound research, which is very satisfying. Because initially I thought that, I have to do PG teaching also. There are a lot of other commitments. So will I be able to finish in 1 year? But because it was a time-bound activity, if you plan, you can really do it. So that confidence a teacher can get, because when you are busy with other administrative work and all, you don't get to do your own research, and that often leads to kind of, you don't feel good. At least I don't feel good if I don't do my own research. You are just doing some administrative work. As you go on becoming senior, then you lose your what I'll say, more genuine nature, whatever you want to do. So this grant actually taught me that yes, I can do, undertake whatever study I want, and it can be finished well in time. because that is very important, because we have limited time available as senior teachers. So I really thank this Indian Teachers of Psychiatry Must Enrich team, especially Dr. Raviteja. He has been very helpful at every point of time for me in presenting and even doing this study. So thank you all very much. Thank you.
Thank you so much, ma'am, and thank you for those kind words. There are so many things that come to my mind. In fact, the first time when Dr. Kishore and everybody mentioned that you would be doing a study, I was honestly very apprehensive, because for somebody so senior and as very junior person, I know how apprehensive and how nervous I get in front of my professor and HOD. I was worried if people would open up to you and share. And more challengingly, you had taken up a qualitative study which not many of us are comfortable with, that requires a lot more effort, lot more time. But when you shared me the snippets of the audio recordings, I was quite surprised how comfortably the students were interacting with you. Just the last study again, which was mentored by Dr. Vikas Menon, we were wondering about how our media amplifies the myths that we have, and what our students, especially influenced by this media, are treating psychiatry. And your study results are quite inspiring and humbling in ways that our students are able to diagnose the problems, but they're not comfortable in treating them. That is a very interesting finding. Just in my recent discussion with Dr. Vishal, who joined us today, sir was also fondly reminding how everybody, all general physicians, are comfortable with just starting remote plus. They know it's a psychiatry patient. They're just comfortable in starting some drug, so they invariably put Nexito plus or something, but they're quite lost. This gives us another opportunity and another understanding, like Dr. Mohan Isaac sir, who joined us the last episode, was telling. We know that everybody will not take up psychiatry, and a lot of them will take up other branches, and that is good. But it is we need to utilize these opportunities like internship to give them the right perspective, and at least give them the right instruments of initiating treatment. This is again, once again, brilliant and very humbling to see you do this study and present your findings, ma'am. Thank you once again for having us in this journey.
Thank you. Thank you so much.
Now, without now we get take the chance of interacting with the mentor of the study, Professor Vikas Menon. Sir, over to you, sir.
Yeah, thank you, Dr. Ravi, and thank you, Dr. Sharmishtha, also for wonderful presentation of the study results. So I remember how, during the initial stages of the proposal discussion, you were very passionate about involving the interns, because they are a group of people who are very important, yet not adequately focused upon for checking whether our curriculum is making a difference, whether they have actually achieved the competencies that we intend to deliver for them. So they are probably an attractive group to study, but they have their own priorities, probably in today's circumstances. You have put in a lot of effort. I have seen the progress of the project, and at various stages there were various challenges that need to be surmounted also, and you have presented your findings. So it is some of the things that were really notable, which I have made a note of, is that our curriculum has still not made them confident in handling common mental disorders, common issues, common psychological issues like grief, then psychiatric emergencies. Then the learning goals are not very clear to them. I think it's more of a diary filling exercise that many of them see the entire internship in psychiatry as. And I also found it interesting that many of them wanted to learn about counseling. So this is something that many of the lay people also think, equating psychiatry with counseling. But perhaps there is a need to emphasize the medical model here. And so, if I can just ask you to summarize back, what are the two major challenges and two major recommendations that you would give? Just distill them into two major challenges and two major recommendations. Both in terms of somebody wants to carry out this study in their institution, how can they learn from your experience to do it a little better? Because I'm obviously sure that there were some challenges that you faced, and the study can be further improved upon. So what would be your take-home messages from that perspective, madam?
I think challenges will be that mainly the interns how to make them aware of these treatments that we give, and how to focus on each and every intern, like how to focus on each and every intern, because at a time you have 5 to 6 interns who are posted with us, and with the limited number of faculty, how to ensure that they learn. It's not like a classroom lecture. So I would say the main challenge is how to make them learn the management. That is one. And secondly, there are some who are not interactive in this focus group discussion, I should admit that, and they did not have much interest in psychiatry. So second challenge would be how to make them feel interested. And what I would recommend is at least there should be interaction with the interns by HOD or senior teacher at least twice during their posting, when they discuss firstly, what all the things they should do, and in the end they can ask that what they have actually learned or are they learning. So maybe after 1 week we can have a review. So there should be some points of interaction with teacher for every intern, a teacher who is fairly senior. So they can ensure that the learning is taking place. And second recommendation would be that we should have some maybe presentation by intern, either a case presentation or small during our PG program we can give 10-15 minutes for interns, and they make a small presentation so that they are actively involved in the learning process. So maybe these are two things I think of.
I agree with you, madam. One another thing I was thinking about as you are presenting is perhaps there is a need to conduct some kind of an orientation at the beginning of the 2-week internship by a senior faculty, so that the goals of the internship are clearly outlined in such a way that they themselves can self-assess whether these goals have been achieved or not, like how we frame specific learning objectives for every lecture, something like that for internship, so that they can do a simple self-assessment at the end. And that can be done by a senior faculty at the outset, apart from all the other points that you said. So that's it. Those are a few comments from my side, but I think there are many seniors here who have perhaps more experience in trying these at their own institutions, and they would like to share their experience, and we can learn from each other.
Thank you so much, sir. I agree. In fact, I remember at CMC Vellore, we used to have this orientation. There were few sheets given to them. We used to have, in the beginning, there was this letter written by an Iranian psychiatrist, Dr. Gami, and he gives a letter to medical students what psychiatry really is and what you should expect and what you should not. And I think that gives a lot of perspective as to what they're supposed to and how can they learn the clear-cut objectives, just like we have other procedures with other specialities. Uh, just quickly going through some comments on the chat box before we take up questions with your permission, sir. Dr. Sebin Kumar, welcome, sir. Sir says, I think that in these type of research, it's important to give an option of anonymity in getting feedback. Obviously, it's unlikely to say anything bad about their own college teachers directly. Maybe they can be asked to fill out forms as a group without mentioning their name. The only way to identify would be through handwriting. Another option is using Google Form where anonymity can be ensured. Thank you, sir. From Samsung SM, sorry, there is no name mentioned. I remember Dr. Vikas telling me that INIS were not implementing CBME. Has that changed? Sir replies that in our institute, CBME has not yet gained full traction. Members from other institute of national importance can opine on situation if their in their institution. Anybody would like to offer comments on this? Next comment is from Dr. Deepak Tiwari. Hello, sir. Rightly pointed, Dr. Vikas, sir. At our medical college, we don't have any students attending lectures and postings. Sir also appreciates Dr. Sharmistha on her presentation and that presentation by interns can be helpful. Faculty need to monitor these presentation. Dr. GP Gururaj, sir, welcome, sir. Sir asks if there are any differences concerning gender of the intern towards psychiatry. Ma'am, would you like to take up the question? Regarding any differences concerning the gender of the intern who participated, their perceptions towards psychiatry in the focus group discussion?
Not actually. Both boys and girls had participated. Maybe girls were little outnumbering boys in giving comments more openly, and they were more interested as far as. But no, even boys said that they want to learn counseling. So I don't feel there was much of a difference. But little outnumbering of girls, yes, that's all.
Thank you, ma'am. I hope that answers the question, sir. Any follow-up questions, sir? We'll proceed then, sir. Dr. M. Kishore, good morning, sir. Sir says wonderful discussion, some experience and some thoughts. The interns are encouraged to play active role in compassionate listening, keen observation, and empathetic engagement. Identify common psychiatric disorders presenting to the particular department: depression, panic disorders, nicotine alcohol disorders, risk assessment and suicide, etc. Identify severe psychiatric symptoms, hallucinations, delusions, etc. Able to use simple screening tools such as PHQ-9, GAD-7, Bath model of psychotherapy, basics of psychopharmacology, concept of disability certificate, art of referral, helping them to solve neat psychiatric questions, and customize internet interest-based psychiatry learning. Example, postpartum depression for some keen on OBG. That is brilliant, sir. You summarize perhaps entire book on how we should design psychiatry curriculum for interns, sir. Thank you, sir. Dr. Sepind once again says, teaching common mental disorders during internship is too late, I feel. This is interesting. Sir continues, adds that there must be some must-know things that must be assessed during MBBS itself. This must be evaluated and competency ensured and only then allowed to pass MBBS. Hopefully, the next curriculum that comes may ensure these, sir. Thank you for those comments, sir. Dr. Harish, sir, welcome, sir. Thanks, we got you right this time. Most of the things mentioned were similar to those seen in the pre-CBME times. Did you find anything new after the implementation of CBME? Ma'am, would you like to take the question, ma'am?
Yes, I think these things are newer. Like this batch, the current batch is, I think, the last batch for pre-CBME. The one which had interviewed or taken discussion, that was not a CBME batch. It a CBME batch had just joined, I think. So, but I can say that the knowledge about psychiatry of the interns, it has really improved. Like they know what all drugs are used, they know the various diagnoses, their attitude is more positive. So that change is definitely there. But about competency, some of them had done some small research study with me in psychiatry. So those specific students, then they are good in their skills or they know psychiatry better. But otherwise, overall, as a batch, if you see, I don't see any difference as of now. The batch, which one? So the currently going on batch is the next one. The previous batch was the one which I had included in the research. So that was not a CBME batch. That's what I would like to say.
Thank you, ma'am.
Shall I give some feedback of my broad experience, not India?
Please go ahead, sir.
Shall I talk?
Please go ahead, sir. Thank you, sir.
Actually, I'm working in Saudi Arabia, and I just want to share my experience over there. We are talking about all the time interest and all the things. But the thing is that the physician has obligatory, it is the obligation of any MBBS applicant or being doctor. It is not just interest that they should deal with the mental health issue. So we should take in a way that it is not just your interest as being a doctor, but it is your obligation that you should address the mental health issue. So if you go a little more further, that it is not just interest, but it is your obligation and it is mandatory kind of thing that you should address minimum common mental health disorder that you must address, even if you are in a different specialty. We know that most of them are not taking psychiatry, but then they have to deal with day in and day out in their practice, whatever subject they choose it. So what I feel is, if we stress on this, that all undergraduate has to know the most common disorder and have to deal with it, irrespective of what they are taking, because in surgery, no, if they don't know, many psychological disorder, if it is present, that surgical, healing process get disturbed. In medicine, so many, take whatever discipline they choose. But then if they don't take this aspect, mental health aspect, it adversely affect the overall outcome, even the mortality aspect. So it is not the interest, but then it is the obligation that you should take the overall health outcome of your patients. And nowadays, there was a little experience in India that I have been to lies in psychiatry, where everywhere people were calling that patient is shouting or whatever, that kind of thing. This is, they are like, whatever subject they will choose in future, they have to face and have to face mental health issue. And it is very important. We have to emphasize that it is very important that it is a part of it in overall outcome of your patient. This is what I feel that we should stress upon. And if you see the overall mission objective of undergraduate education, it says that they should know minimum what are the common mental disorder and how they should treat it. If you fail in that respect, in terms of training or teaching, then yes, it is our responsibility. Thank you very much.
Thank you so much, sir. What you said is very true. This is Dr. Dushad Ram from Saudi Arabia. Dr. Menon, sir, would you like to add anything based on the previous questions and comments by Dr. Dushad Ram?
Yes, specifically, not only with Dr. Ram's comments, which have been, which is also valid, but some of the other previous comments. So, Dr. Sebin's comment also that, internship is probably a little late to catch them. I fully agree with Dr. Sebin, but I think what Dr. Sharmishtha has presented is probably a reflection of what has gone through the training process over the last 4 to 5 years. And that is what they are coming and telling us, that they don't feel confident in recognizing or handling CMTs when they come to the internship stage. At the internship stage, we are seeing them as a finished product because they are now going to go into the community and practice, but they don't have the necessary skills or confidence to do it. And perhaps, as many people are pointing out to this forum, we need to start restructuring our entire educational spiral in terms of objectives, teaching, learning methods, and assessment. We need to redesign it so that the intended competencies are delivered. I think at the moment, teaching is becoming too broad-based. It is not focused enough on the competencies that we intend to deliver. It is not getting assessed adequately at the graduate level. So at all stages, there are issues that are just revealing themselves during the internship. Because at internship, we are going to have these kind of next exams and other exit exams to certify them, and that's not going to, they're just not going to be confident here. So there's another comment also in the box that we need how about video-based teaching? So yes, we need to have innovative teaching learning methods which are objective or competency focused, and at the same time are also accessible in the sense, they can be used to the interns, the UG students can also self-assess themselves whether they have achieved the intended competencies. And then probably at the internship stage, we can have different kinds of assessments, like what we call entrustable professional activities, or some kind of EPA-based testing, which bunches these competencies into units of professional practice that they're actually supposed to go out and do. Like, say, for example, how to handle a suicidal patient in the emergency setting. So or an agitated patient in the emergency setting, or how to initiate an antidepressant for somebody with depression. So it involves various steps like diagnosing, then discussing about the risk benefit, and so on. So we really need to think about the curriculum longitudinally. It's not about looking at the internship cross-sectionally, not at all. What we are, I think what Dr. Sharmishtha is trying to say here is that there are problems at various stages of the training, which are bringing the issues out in the fore during internship. And we need to take a longitudinal picture and think about how we can redesign the curriculum. This is what I have to add here.
Thank you, sir, for those valuable comments. And I think, like Dr. Dushad Ram was saying, I think it becomes an obligation because this, it's also because it becomes an obligation to understand their narratives and perception. Only then we'll be able to address the stigma and the various aspects that are become very hard to be addressed once they turn out to be complete doctors and independent specialists. Dr. Saurabh Tandon, sir says, my thinking is that if we focus the problem seen by interns in their surroundings, then their interest will increase. Yes, this is very keen observations, are very true, and there are enough psychological problems all around. And then we are seeing quite a. They say that we'll be seeing a pandemic soon, and I think we can discuss starting with gaming to mental health problems in and around all the different things the newspapers report. That would be a very good point, sir. Thank you, sir. There is a discussion going related to the gender. Dr. Sharmistha Madam said that she did not see any such differences, but an interesting observation by Dr. Sebind and Dr. Harish. Sir says that more women are taking up psychiatry. Dr. Harish explained that this skewed data is because more females are entering medicine itself, because obviously now we are seeing nearly 70% of medical students in most medical colleges are women, and then that therefore this explains further increase in psychiatry. Dr. Sebind adds to this narrative that not only this that but women also find psychiatry is an easy specialty, no round the clock duty, no need to attend emergencies like in surgical or medical. They feel more time can be spent with family. Obviously this cannot be generalized, but some candid responses sir has gotten over the years. Wonderful, sir. Thank you for sharing your experiences. uh, Anything would the speaker or mentor would like to add to these comments?
Yeah, even our college, we have more female students, PG students taking up psychiatry. So I agree with that observation that now there are more girls entering into psychiatry.
Thank you, ma'am. Professor Christina George, ma'am says, I feel license consultation encounter should be an objective. And madam agrees with Sebend about CMDs. Uh, Ma'am also says we can do OSCEs on competencies in CMD during end of postings. We saw a lot of OSCEs, especially during COVID pandemic. In fact, a lot of practical exams were cancelled and replaced with OSCE examination. In fact, TIPS released a book on OSCEs in itself, and I was a part of that initiative. Definitely, ma'am. I think we should definitely consider those options because we did receive a lot of great feedback. Lot of interesting discussions on the chat box, and I would like to continue. Dr. Kumar, how about the option for video-based teaching of topics for interns? Any such stock teaching videos available? Given the short period, minimum faculty, and multiple competencies to be covered, any comments? Thanks. Sir, you could check out our last video on the ITOPS must enter YouTube channel. In fact, the last study was completely entirely based on using online teaching methods. Maybe that could add further to what you have on your mind. To this, Dr. Sebind replies that yes, NIMHANS, JIPMER, CMC, St. John's, etc. can collaborate or be encouraged to make these videos, which can be spread all over India. In fact, all of them have been working on this to the best of my knowledge. CM's, NIMHANS has their own distance education channels. In fact, CMC's distance education curriculum, headed by Dr. Johan, they have been on a mission to train semi mental health professionals across remote parts of India using these stock videos, but they come at a small cost and a well structured curriculum, sir. You could check that out as well. Dr. Kishore, sir says, ma'am can further move and see if she can come out with some entrustable professional activities, EPA, for psychiatry internship, 80% applicable for entire country, 20% flexibility for respective departments. That is a very interesting comment and feasible and would be a wonderful initiative to launch too, sir. Any comments from the audience on this? Dr. Sharmistha, ma'am, please go ahead.
Yes, I think this is really interesting, and I shall definitely like to take up, and I will take it up in near future. That I shall give them.
Ma'am, would you like to unmute yourself?
Yeah. So I shall like to take up, and I will definitely do that.
Okay,
This
ma'am.
is really nice suggestion.
Thank you, ma'am. Sorry, I thought it suddenly got muted. Thank you, ma'am. Dr. Seben says, sir, agrees with Dr. Vikas, I guess, that even if we ask these questions to our own interns here, we will get responses that they're not feeling competent. It reflects on us, teachers themselves. Very hard questions to ask, sir, especially on a Sunday. But thank you for the feedback. Uh, Dr. Adi Sheshama, ma'am, welcome, ma'am. Ma'am says that it is a good idea and excellent presentation, ma'am. But during internship, they should be physically involved in treating process, learning by doing. Excellent feedback, ma'am. Definitely. Dr. Hinal Shah, welcome, ma'am. So, ma'am says that ensure teaching of undergraduates and then build on the skills as interns. This is an extension to the discussion that Dr. Sebin, Dr. Menon, and all of them were, Dr. Dushadram were talking about what is being done in UG and how we have to work on it on them as interns. Sure, Dr. Saban, we will share the OSCE book with you. Dr. Kishore adds on to the discussion by saying Dr. Subarna Jyoti from SRM has done some work under Must Enrich grant on video sessions for CBME. Yes, it is a work under process, and you're quite excited to look at the results as well, because the work of building videos, as ma'am tells me whenever I follow up with her, is extensively large, more than we could imagine, have to undergo multiple rounds, and we are all quite new to this world of digital recording and editing, and as doctors, I think it is very hard for us to but I think if we are doing well on this Zoom platform on this Sunday, sure, I'm sure there is a lot of prospects for us in the future as well. Would anybody else from, I see a lot of senior psychiatrists who joined us on this Sunday. Thank you so much, all. People who have been actively involved in teaching from various parts of this country. Would anybody like to further add to this discussion or share their own experiences? You're all most welcome. We still have 10 more minutes for the meeting to close. Looking forward to any further feedback. Dr. Sebin, sir, please unmute yourself. You can
Hi,
speak.
hope you can hear me.
You're audible,
Regarding CBME, what I felt is that after the CBME started, the competencies of my students have gone down. What has happened is previously, they used to come for like extended 2 weeks postings, and we had we had the more time. Like they were there in the department from 8 to 12. Now in first year, after the first year, they come from 9 to 12. And they come in more numbers. Previously, we have 175 students here in Thrissur. And previously, they used to come in a bunch of 14 students. Now they come in a bunch of 30 students at a time. And we have 6 consultants, and 30 students is a huge crowd, and we can't even remember seeing their names and their faces, and all of them, we have to sign the logbook. The signing the logbook itself takes a huge amount of our time. Like after one hour of classes, if you want to sign the logbook of 30 people, and they have different columns like that, that is how the logbook has been designed. So on whole, after whole thing, I think their competency has come down is what is I felt.
I think as an alumnus of CMC, I can feel your pain, sir. And often, because we believe in structuring based on the local environment, and when these training gets generalized, a lot of these issues are propping up. Thank you for those observations, sir. Any further comments or experiences from other audience on this group with related to the changes after implementation of CBME or the challenges that you're facing? Professor Hinal Shah says it is yet a battle with dams classes and to get the students to attend internship. So true, ma'am. And I think it becomes an obligation for teachers teaching psychiatry in dams and other such colleges, and to do this bit. And another interesting thing, one of my colleagues were telling that if they can convince their medical colleagues to put in a main question or the long question on psychiatry, usually there is a lot more interest in the next batch of students to learn about psychiatry.
May I come in? This is Dr. Christina.
Absolutely, ma'am. Please
Yes,
go
yes.
ahead, ma'am.
So just to answer Sebin, The number of students who come to psychiatry is entirely in the hand of your curriculum implementation, program faculty who make the timetable. It's very complicated to make it 15, but if you are ready for a hard battle, you can do it. Okay, that's one. Two, I agree, the signing logbook should ideally be done every day. What we do it in a little bit more trusting manner. We ask the rep to keep a record of all cases seen, all classes taken, and that rep hands it in to us after 15 days, and only after 15 days after the end posting. In about 5 days, does somebody cross-check that they have entered this logbook correctly? So that's one. Two, the end of the clinical posting, and this is part of the building up of competencies. It takes time again, but two faculty do sit with students and do OSCEs on diagnosis of depression using a simulated patient and talking to a patient with panic disorder regarding treatment options. But it takes time, but it does feed into the competency of eliciting signs, symptoms. And that is in the first posting. And second posting, something to do with management, discussing treatment options. So it does address those two. This is just about building up competencies so that you have EPAs that are possible to be worked on during internship. But it requires concerted effort, and dedication where, two faculty will be doing just that on the end posting. On one day, at the end of the 2 weeks. That's all. Thank you.
Thank you for those excellent suggestions, ma'am. I think Dr. Sepin also got his answers. So glad to get answers on this platform from other alumni as well. Dr. Harish, sir says, I think students, the number of UG students posted to psychiatry should be around 15 at a time to do CBME. For interns too, this is perfect. Sir adds by saying that in a medical college, NMC mandates only 3 faculty and 1 SR. It is impossible to do justice to CBME with the staff strength. Thank you, sir. Dr. Prasad Deshpande from Aurangabad. Sir says implementation of next is the ray of hope. And thank you, sir. That's I hope everybody's looking forward to it as well. And yes, thank you.
Just one comment, if I may come in, Dr.
Please,
Ravi.
sir. Thank you, sir.
So apart from the issues of faculty shortage and student excess, which is being talked about here, there are also other infrastructure constraints, I think, which most institutions are facing, like small group teaching is supposed to happen in CBME, but there are not enough rooms to conduct the small group teaching. For CBME, the learning resources that are provided to the students have not changed, although that has to change in accordance with the CBME objectives. It's supposed to have CBME textbooks. I think right now in this context, I must also, many of the group members may already know, but IPS is actually preparing one CBME compatible textbook of psychiatry for undergraduates. So it may come out anytime soon. So these are also some of the things that we need to think about. The infrastructure facilities, the CBME resources for learning have to be provided. Then only we can assess them according to CBME pattern and certify them. Without providing them the learning resources, it is not fair to expect them to develop all the competencies.
Thank you for that, sir. I would like to thank many for the success of this program: Dr. Kishore, Dr. Kiran, Dr. Ajay, Dr. Vinay, Dr. Sujitkar, Dr. Dhirendra, Dr. Pooja Shabdal for the coordination of this program. And before I close this program, I would like to request Dr. Kishore, sir, if you have any comments, any closing remarks, we would be very happy, sir.
I believe the program went really well, and a lot of discussions in the both chat box and the thing. Undergraduate psychiatry is one of the most challenging tasks for any institution. Even though all of us have been recruited to medical colleges to teach undergraduates, over time it becomes that we are part of more and more patient care and postgraduate teaching. So I believe that we should continuously innovate new things and come out with engaging undergraduates, because in a ratio of 1 to 500, we will be engaging undergraduates than the postgraduates. So I believe our investment in undergraduate will continue to be very fruitful if we put our heart into that. And all faculty may have to play a role, not just 1 or 2 faculty in the department. Even though we talk about 4 or 5 in the department, not every faculty will have same inclination. That's a big challenge. And how do we empower postgraduates to engage undergraduates, specifically interns? So one of the aspect is engaging the postgraduates to have an involvement with the interns will be one thing which will have a fruitful outcome. These are my small observations.
Thank you so much, sir. I think the last comments added by you and Dr. Menon not only inspires the existing faculty, but also helps a lot of upcoming departments plan out and hope what they should be prepared for. And to close, I would like to read the Dr. Semon's comments, who says infrastructure is important. We are unable to accommodate 15 students into 4 small OP cubicles that we have. And we also have BSc nursing, MSc nursing interns to accommodate. And yes, definitely we'll have to not only design the program, but also perhaps looks like we have to redesign our infrastructure as well as to be able to implement the CBME. Thank you all. I would thank you once again for joining us on this Sunday. I hope, like how Dr. Sebin feels, it has been an enriching and inspiring experience, just like it has been for me as well, and definitely a Sunday afternoon well spent. Thank you once again, and we look forward to the next episode of this grand series, and see you next Sunday.
Thank you, everyone.